The thyroid nodules are essentially a discrete lesion within the thyroid that can be thought of as a mass or a lump, and they can represent many different things. But as opposed to just thyroid enlargement, which is sometimes called a goiter, these are really a discrete finding that you can delineate either by feeling it or on different sorts of imaging. Thyroid nodules are very common and they occur throughout the age range. And so everyone from children to old individuals will get thyroid nodules, men and women, but there are a few groups that are more likely. Thyroid nodules do occur more as we age, so they'll be more common in older individuals, and women are more likely to have thyroid nodules than men. So there are a number of things that may increase the risk of having a thyroid nodule, one of which is iodine deficiency, although that's rare in the United States. People who have had radiation exposure to where the thyroid is in the neck, particularly if that happened in childhood, are more likely to have thyroid nodules. And people with underlying autoimmune thyroid disease, which is sometimes called Hashimoto's or lymphocytic thyroiditis, may develop thyroid nodules also. Most thyroid nodules are going to be asymptomatic, and they're often found incidentally on different kinds of testing. But a number of them can be either felt by a person or by their physician during an examination as a small sort of firm lump where the thyroid is in the neck. There are some symptoms that may be more worrisome that a nodule is large or potentially something that would be dangerous, such as a cancer, and that would include a very hard, immovable lump in the neck, changes in the voice, such as hoarseness, difficulty passing food at all, or significant difficulty breathing. Almost all thyroid nodules are going to be benign, essentially a benign lump in the thyroid, but the concern about having a thyroid nodule is that it is a thyroid cancer. Primary way to evaluate a thyroid nodule without removing it surgically is what's called a fine needle aspiration biopsy. And in that procedure, patient comes in and using an ultrasound to guide the way, a very small needle is put into the neck, into where the thyroid nodule is, and cells collected for evaluation. It's a short, well-tolerated procedure that's done under local anesthetic typically, and patients afterwards are able to go home with very few issues. Surgery can be required for the treatment of thyroid nodules in a variety of situations. Primarily, if a biopsy is performed and a thyroid nodule is found to be a malignancy, typically a thyroid cancer, the standard treatment at this point is a surgery to remove that nodule, and typically the thyroid in its entirety as the first step in treatment for thyroid cancer. There are other cases in which surgery will be necessary. Some nodules, even after biopsy, can't be definitively described as benign or malignant, something we call indeterminate, and those may need to be removed surgically to really know definitively what it is. And then there are cases in which benign thyroid nodules need to be removed surgically because they're large and they're compressing in a place that's giving a patient symptoms that aren't well tolerated.